Hello everyone, I'm Taha. I'm a fourth year medical student, and in this video we're going to go over the pathophysiology of asthma. Alright, so let's jump straight into it. Just to understand asthma a little better, we're going to introduce a patient. Alright, so let's imagine we have a patient and his name is Mr. Whitecoat. Alright, so Mr. Whitecoat comes to you and he has asthma. So let's understand the pathophysiology of asthma so we can treat Mr. Whitecoat accordingly, okay? So the pathophysiology of asthma is a little difficult to understand, but if you break it down into three main headings, we can categorize it quite well, okay? So let's have a look at what the first heading would be. So asthma can be characterized by airway, or I should say chronic airway inflammation, right? And this really is the backbone of what asthma actually is. So asthma is a chronic condition of the airways within patients' lungs, alright? And it can cause episodic periods of bronchoconstriction. This is when you've seen patients who may have had an acute asthma attack and they're, wheezing and they're out of breath, and that can be reversed through things such as inhalers. Alright, so we'll have a look at that further in this video. So the first heading would be chronic airway inflammation. The second one would be, like we mentioned, reversible bronchoconstriction. Okay. So reversible bronchoconstriction, like we mentioned, you have probably seen patients who are able to take inhalers, and that can alleviate the symptoms of asthma. And the final thing that we can break down is something called hypersecretion, right? And hypersecretion of what exactly? So hypersecretion of mucus within the airways of the lungs, right? All three of these contribute essentially to airway constriction, okay? And when the airways of the patients are constricted, as you can imagine, right? Let's imagine these are the airways within Mr. Whitecoat's lungs. In under normal conditions, the air will be able to pass through the lungs without any problems, right? Although in asthma, like we mentioned, there's chronic inflammation, and let's understand why the chronic inflammation exists in the first place. So, the reason why there is chronic inflammation in patients with asthma is because their lungs are hypersensitive to certain stimuli, right? Stimuli that may otherwise not cause, an acute exacerbation of symptoms in other people, but will cause symptoms of asthma within patients who have this condition. So, those sort of common triggers may include things such as pollen. It may be things such as cold weather. It can be exercise. It could even be cigarette smoking. So any sort of thing that irritates the lungs, these then triggers go within the patient's lung and cause an overactivity within the body that leads to the chronic inflammation. As we know, with any sort of inflammatory process, the tissues that are inflamed become swollen, and as these airways become swollen, they constrict, right? And this constriction leads to the narrowing of the actual bronchi and the bronchioles within the lungs. So when the airways constrict, it means less air can actually pass through. Now, when less air is able to pass through the lungs and the airways, we get the characteristic sort of wheezing, right, sound that you might have heard with patients who have asthma. It can also lead to the shortness of breath that patients experience. You can also experience tightness, right, within the chest area because it quite literally is constricting of the airways within the lungs. And sometimes there can even be pain involved during this process, right? As well as coughing. So that process is what we call the chronic airway inflammation. Now, reversible bronchoconstriction, this is when the smooth muscles within the airways. So let's have a look at Mr. Whitecoat's airways, right? So here we have the lungs, right? We have the left lung and the right lung, and then we have the trachea that comes down and then splits, okay, into the left and the right bronchi, then further splits into the secondary and the tertiary bronchi, into the bronchioles, and then into the alveoli, right? Now, the actual airways are also covered with smooth muscles, okay? Now, these smooth muscles can constrict, right? And it is known as bronchospasm. Now, when these airways constrict, they again narrow, okay? Which means that less air is able to pass through, and again leads to the symptoms that we've mentioned here, right? The final thing that we can look at is airway hypersecretion. And what does that mean? Airway hypersecretion is, we need to first understand that these airways are also lined with certain types of cells, right? These cells are known as goblet cells, right? Goblet cells secrete something called mucus, okay? Now, in otherwise healthier patients, this mucus is also very important in the normal functioning of the lungs, as it traps certain pathogens and allows us to then swallow the mucus and kill off the bacteria that may cause us infections. But with patients who have asthma, this mucus production is increased highly, okay? Now, when this mucus production is increased, it means that it further contributes to the narrowing of the airways, okay? So in the end, you get an effect of all three processes. So chronic airway inflammation, reversible bronchoconstriction, and also hypersecretion that leads to the characteristic features of asthma. Now, one other important thing to mention here is that asthma is also known as an atopic condition. Okay, so let's understand what this means. Atopic conditions are an umbrella term that means that there is a group of conditions that may coincide within patients and oftentimes run in families. So asthma would be one of the atopic conditions. You may have also seen patients who have asthma may also have eczema and also hay fever, right? So these can often run within siblings, families, and patients may oftentimes have multiple conditions at the same time. So this was the first video in the series of asthma. So today we looked at the pathophysiology. In future videos we will look at the clinical symptoms as well as investigations and management options for asthma. So if you're interested in those, then click the link in the description or the card within the banner, and I'll see you guys next time.